Now, Union Health Minister Dr. Harshvardhan and his wife Nutan Goyal took the coronavirus vaccine shot today at Delhi's Heart and Lung Institute. Interestingly, it was a private healthcare facility where he took the shot and paid that 250 rupees. Now, the health minister got the Covaxin vaccine, which is the indigenously developed vaccine which is developed by Bharat Biotech. And he said after he received his vaccine that I request everyone to get vaccinated. After 28 days of the first dose, everyone should get their second dose. Do not worry if you experience minor side effects, but do let your doctors know. So that is what the Union Health Minister said after he received his vaccine today. Now, today is day 2 of India's second phase of the inoculation for those above 60 years of age and people between 45 and 59 years of age who have specific serious illnesses. 4.27 lakh vaccine doses were administered on the first day of phase 2 of the vaccination, that is on Monday. Now, so far, 1.47 crore vaccines have been administered in India in 45 days into the pan-India COVID vaccination drive. Remember, this vaccination drive began on the 16th of January, and now we have reached this 1.47 crore vaccines having been given to people, though there were worries about the vaccine drive not moving as fast as we would have liked in the first phase, which is when healthcare workers and frontline workers were to be vaccinated. 3 crore were expected to be vaccinated. However, it's 1.47 crore so far. Now, many political leaders and personalities have got vaccinated today. There you can see BJP leader and Minister Mukhtar Abbas Naqvi getting vaccinated as well. Remember, yesterday the Prime Minister kicked off the vaccine drive, being the first to receive the vaccine in this second stage. You also had leaders like Omar Abdullah who tweeted about receiving the vaccine. Also, Kamal Hassan tweeted, Omar Abdullah of course tweeting about his father receiving the vaccine, Kamal Hassan tweeting about receiving the vaccine. And you had Ravi Shastri also tweeting about receiving the vaccine. So great boost to the vaccination drive, with more and more personalities and leaders going ahead and getting vaccinated. People across the country are also lining up to get vaccinated. Well, to talk more about the vaccine drive, we're now joined by Dr. Hemant Deshmukh, Dean of the KEM Hospital. We'll also be joined by Dr. Arvind Kumar, Chairman of Institute of Chest Surgery, Medanta Hospital, later. But Dr. Deshmukh, thank you so much for sparing time for us again, and tell us after day 1, what have you learned about the vaccine drive? Where were the obstacles, where were the hiccups?
Good afternoon. The major hiccups right now are with the COVID app, which is being circulated amongst everybody. The registration process is taking time. Sometimes there is a major technical glitch which happens, and I probably presume that this glitch is going to happen for the simple reason that a lot of people are actually getting online onto this COVID app, and this creates a lot of traffic across the COVID app itself. And this entire technical glitch is hampering the process of vaccination at major centers where senior citizens are going to come. Now, this technical glitch, though it is a temporary phenomenon, it's probably the fact that day 1 and day 2, a lot of senior citizens want to get vaccinated this week itself. I think my personal opinion would be, let us take it slightly lightly. Let us see to it that we register on the COVID app as and when it gets opened up. And we really need to have a lot of patience.
I think it's also important to point out that, while earlier, of course, we kept talking COVID app, Arogya Setu app, but actually when it went live, it was actually the COVID website that everybody has to register on covid.gov.in, and in fact that is what created a bit of the confusion, because everybody was trying to do it on the app, whereas it's the website that one has to go to for the registration, isn't it?
Yeah, I think the website also has a lot of technical glitches. It's probably simply that many people are trying to log into simultaneously across the entire country, and this traffic jam which is causing a technical glitch on the COVID app is probably somebody gets an advantage of a higher bandwidth that get technical highway. And once they register, I think there are a lot of glitches ahead also, wherein you get an appointment for a particular day or a particular month. Probably this time, the entire March is out of bounds right now. What we are getting today is probably some date somewhere in the first week of April. I think unless you register, you will not be given vaccination out of turn in any of the centers which have been designated for the vaccination.
Right. So, Dr. Deshmukh, because it's also being told that, people can do walk-in registrations, and I think this is also creating some amount of confusion at this point because, hospitals, private hospitals are still figuring out this vaccination drive. In fact, if we can just take a look at this video that was tweeted by Mr. Harsh Goenka, an industrialist, and this is of the vaccination center in Mumbai, the BKC, I think, vaccination center. And just take a look at those crowds. So there's no amount of social distancing. If I could just describe it to you, it's got lots of people crowded there and everybody's in line. But, everybody's crowded together. It seems there's a lot of waiting also going on. So this is the sort of situation we want to avoid at vaccination centers, isn't it?
Yeah. Rightly said. I think the amount of enthusiasm that this vaccination drive has caused in the city of Mumbai or Maharashtra, these are jumbo centers, and most of them want to rush to a place where there are large facilities for vaccination, which can happen simultaneously for a longer period of time also. And most of the citizens of Mumbai are situated in the suburbs of Mumbai, and they are finding the NESCO at Goregaon and the BKC at Bandra to be the most convenient sites for vaccination. I think they are just rushing into the vaccination site for the simple reason that they want to getting the first mover advantage, or rather they want to get the first mover jab itself in the city of Mumbai.
All right, and that's something we don't want to happen. So I think people should, just wait. But at the same time, Dr. Deshmukh, it's also good to see that people are enthusiastic about the vaccine, because we know that regarding the vaccine drive, so far hesitancy has been a big problem. We were expecting 3 crore people to be vaccinated by this time in the first phase, which included the healthcare workers and frontline workers. But we've vaccinated 1.47 now. But that's the amount that we managed to vaccinate in the first phase. We want to vaccinate a total of 30 crore by August.
Yeah, there are two things which come to this aspect of vaccination program or the drive which has been undertaken. One is that we need to increase the number of sites which the Municipal Corporation of Greater Mumbai is on the job itself of increasing the number of sites. We are also trying to increase the number of terminals which can be accommodated in each vaccination site, so that more number of vaccinations can happen at each table or a center. Thirdly, there will be private centers which will be allowed to open up in the near future. And the fourth most important point would be the waiting period, that is 30 minutes after the vaccination. Unless the government of India gives us some kind of leeway where the waiting period can be reduced to, say, initially 20 minutes and then to 10 minutes, I think more centers can accommodate more people at a time.
All right, and that is perhaps something we see in the days to come. But I'd like to, put some questions to you that have been sent in to us by viewers. One of the questions is that by the time everyone is vaccinated, what happens to new variants coming up? Do the vaccinated remain protected? I think that's one of the questions a lot of people have, especially since what we're seeing abroad regarding the variants.
Yeah, if I get the question right, what they are trying to tell, the antibodies which are getting formed within the individual after vaccination, I think the peak day or the peak period when the antibodies are getting formed will be only after the second dose of vaccination. And that also would be at least 1 to 2 weeks after the second dose is received by the beneficiary or the recipient. The antibodies are not going to form after the first dose of vaccination, and the triple pillars of preventing this coronavirus still remain.
Right, and he also wants to know whether it will protect against the mutated coronavirus, the mutated disease. Will this vaccine protect against that?
Yes, by and large, this vaccination which is happening with Covishield and Covaxin is going to protect everybody against the future mutations also, or the current mutations also. The only difference is that a specific mutation will not have a specific vaccine which can be produced in the near future. if 70% or more people are vaccinated with this, the mutations will definitely be, the mutations can definitely not cause a very serious kind of disease, that is
Right.
coronavirus, amongst those vaccinated.
All right. Another question that we have is regarding if Covishield is effective for 65 plus senior citizens. Claims that it's not from many European countries except for the UK. And I know this has been a controversy. In fact, just now Canada too has said that their agency, their expert committee on vaccines has said they don't recommend it for those over 65. But that's only because data is not available. Not enough testing has been done. Dr. Deshmukh, what would you say?
We had been the center for this COVID shield for the safety and the what you call as the safety data which has come from the third phase of the trial of Covishield, and we have really found that during this period, most of the trial beneficiaries were above 60 years of age. And this is going to be a large pool of data right now in this second phase and the third phase, wherein people who are above 60 years of age are going to get Covishield vaccine. The safety data is robust. The antigenicity or the amount of antibodies that are going to form is also going to be a robust data. And once this data, which is probably forthcoming in the next 2 months, I think the amount of data that can be gathered will be a sufficient result of the entire vaccination program. And we will have a robust positivity amongst the Covaxin as well as Covishield. And hence, I think India will depend more on the local Covaxin as well as the Covishield jabs that people are taking right now.
All right. And one more question is about who should be vaccinated. And this viewer is asking, we should include teachers and school staff on priority vaccination schedule. Now, we do know the elderly has been decided by the government. What would you say to this? Because these are people who are really out there, especially teachers in schools, and whether they should be included.
Actually, when you talk about schools, the school children are less than 18 years of age. Right now, the Covaxin or the Covishield trials which are happening are above 18 years of age. So the teachers which are going to gather in the classrooms are not going to be mixing with the adults, but they are going to mix with the children. So they will definitely come forward as the frontline workers once the general data of 65 for 59 gets over and the frontline workers are over for the second dose. The third phase, which will begin, which will be for the school teachers or college teachers or anybody who is less than 45 years of age and without any comorbidities.
All right. Well, hopefully the media will also be included there, and journalists. Thank you so much, Dr. Deshmukh, for joining us and sparing time and answering all those questions. Well, let's now get you news from the United States. And Moderna, Pfizer, and now Johnson & Johnson will deliver enough doses to fully vaccinate 130 million people. That's more than 1/3 of the U.S. population by the end of March. That's what the pharmaceutical companies have told a House subcommittee last week. But there is also a word of caution as the vaccine drive moves forward. The director of the U.S. Centers for Disease Control and Prevention has warned that the U.S. is at risk of losing all its recent gains in the battle against COVID as highly contagious variants take advantage of Americans getting lax with safety measures. So she's saying remain on guard and don't get lax about those safety measures and COVID protocols. Well, to talk more about the situation in the U.S., we're joined by Dr. Ishita Devi, Assistant Professor of Medicine, Lenox Hill Hospital, Northwell. Thank you so much, Dr. Devi, for joining us on the show again. So first and foremost, how does the J&J, the Johnson & Johnson vaccine authorization affect the vaccine drive in the U.S.?
Thank you for having me on the show, and hello from New York. This is exciting news for all of us that a third vaccine has now been approved by the FDA for use in the United States. And this comes at a critical time when we are trying to upgrade the vaccination drive and trying to fight the pandemic by increasing the percentage of population that's vaccinated and trying to get past the pandemic as well.
Now, the CDC director has given quite a grim warning about the recent decline in cases and said that, they may be stalled as variants spread. How big a threat are the variants in the United States?
Yes, it's good news that the hospitalizations as well as the new cases every day have seen a decline. It looks like we're past the peak of the pandemic numbers that we saw late in 2020 and especially November, December, and January 2021. You are right that we do worry about the new variants from South Africa as well as the United Kingdom, but it remains to be seen whether how effective the vaccinations that we have currently so far with Pfizer and Moderna are against these variants. So we do remain cautious, and we still maintain that everybody should still wear masks and practice social distancing as much as possible, even if they're vaccinated or awaiting vaccinations. And we should not take this tapering of numbers as a measure to relax on the precautions that we have been taking and we know that are very effective.
Now, some experts have even said that perhaps it's change in behavior of the American population recently that's caused this tapering of infections rather than the vaccination drive. What is your view of that?
Yes, largely it is the change in the behavior, including wearing masks, mandating masks now by the federal government on all federal sites, as well as we're past the holiday season, so people are not traveling as much and there's less socialization compared to the holiday season in December. Currently, only 15% of the U.S. population has received a single dose of the vaccination, and only 7.7% has received both the doses of vaccination. So it's hard to say that vaccinations are the driving factor, but over a period of time, we do think that that will provide herd immunity and also help to decrease the number of hospitalizations, death, and the total number of cases.
Now, if we talk about, vaccinating the whole world, the good news is Colombia received its first supply under COVAX. And do you think rich countries like the United States and UK should contribute more to this need across the world right now?
I think it has to be a balancing act where we have to obviously protect the population in the United States, as well as the vulnerable population worldwide. So I think it's going to be a matter of prioritizing the vulnerable population, whether it's in the U.S. or the countries abroad, but also making sure that we reach the vulnerable populations within our country, as well as the rural populations within our country, which may have limited access to vaccinations as well.
All right, that's always the tussle within the country. Thank you so much, Dr. Devedi, for joining us here on NDTV.